We are back on MorningLine. Thanks for joining us on this Tuesday. We're talking, as you see on the screen, about Mental Health Awareness Month. We have 3 representatives from the Tennessee Department of Mental Health and Substance Abuse Services. The Commissioner, Marie Williams, is with us this morning. Bo Turner and Matt Yancey. Thanks both for coming on. Sure. And we're going to take some phone calls. Actually, we got a call that waited through the break. Let's take that real quick before we get into some more of our topics. But the lines are open if you here's something we're talking about and you want to jump in. Let's go to Todd. Hello, Todd.
Hi, Mr. Barris.
Good morning, sir.
I talked to you before. I was trying to get my Social Security.
Yeah.
And I have seen, I've been out to mental health walker twice in Clarksville. I live in a camper. I don't know if you remember my story or not, my situation. But I have taken my little dog twice with me. He goes everywhere with me. It's just me and him.
Yeah, in your camper. And are you dealing with mental health issues?
Yes, sir.
Yeah.
She diagnosed me with PTSD and chronic depression. My dad got killed when I was 6 in an airplane crash, and
that's right. I remember your story. So what is your question, or are you wondering about more services that are available to you or where you could seek some more help?
Well, with your staff that you have on, I was going to ask them. My dog's not certified as a service dog, and I was wondering he's just a Shih Tzu. He's real friendly. He doesn't,
But he keeps you calm. Your dog keeps you calm.
Yeah, I take him everywhere with me. I mean,
Sure.
I really, and I don't know what I need to do to.
Okay, I think he's probably calling, and I don't know if that's a little outside your realm, but I mean, in terms of mental care, a lot of folks like him have pets. Animals can be wonderful to help you through that. Now, getting certified as a service dog, and there's been stories done about people just certifying everything willy-nilly, and you can't do that. But this dog certainly helps him.
Right.
I don't know.
Couple things I'd say. Number one, I'm so glad that he's talking about the fact that he's going to the mental health co-op and that he's getting treatment.
Okay.
He knows what the diagnosis is. We know mental health co-op, they do a fantastic job with treatment, and you can tell he's doing well.
Yeah.
As it relates to the question of the service dog, that is not something that I would be able to speak to, but I would imagine that if he spoke with his care coordinator at the mental health co-op and said, can you help me figure out what to do related to a service dog, that they could help him. Okay. That is what I would say.
Okay. I wanted to ask you this when we were talking in the first segment about, the services that are out there and community outreach and people coming to you. One thing that right now is on a lot of people's minds is, mental health and some of these individuals that are involved in these horrible shooting massacres. Yeah. We just had what happened at the Waffle House. And there seems to be little doubt that this individual who showed up naked and went on this shooting rampage had some real issues based on what we heard, not in Tennessee, but out of Illinois, where he ended up getting his weapons back.
Right.
And Second Amendment, big thing in Tennessee, but I think even the most avid gun lover is going to say, we don't want guns in the hands of people that are mentally ill. I'm just wondering how you guys look at addressing that issue. And, if someone comes through, they haven't been charged with a crime yet, but clearly they've got some real issues. You're concerned that something's coming down the pike on this guy. Who do you alert to that in case they want to get guns, and how do you handle that?
Yeah. First off, I want to make sure there's a clear understanding about violence in people that have mental health issues. Research shows that they are more likely to be victimized than to actually harm someone. Yeah. It's like 7 times more likely to be a victim than to harm someone.
I agree with you. That's right.
So that's the first thing.
Sure.
Secondly, our state just passed new legislation as it relates to our RMHIs, our regional mental health institutes. Nothing really changed related to our reporting requirements. We are required, if a person is put into one of our hospitals and committed, to report that to local law enforcement. They did add 3 items they wanted us to expand, which is Social Security, race and sex. So those 3 items were added. The one thing that Bo can speak more to is what it did for other hospitals. So again, for us, we've been doing what we do. We've been reporting to local law enforcement. Bo, do you want to add for the rest?
So those facilities that we, the department licensed under Title 33, have had this reporting requirement all along. The requirement is to report to local police authority. What this new legislation did is now apply to hospitals, med-surg hospitals who are licensed by the health department that we would not touch from a licensure standpoint. They now also have that same requirement. So if you're a psychiatric unit or a freestanding like Centennial Parthenon Pavilion, you now have this same requirement that all the freestanding psychiatric hospitals had. So it's just another level of notifying the authorities so people minimize falling through the cracks around issues like that.
And that's once it gets to you, and I wonder if you have any advice for folks where it's not to the point where someone from a judicial order or an arrest is being referred to, but in so many of these shooting cases, and you're absolutely right about mental health, people like that are not inherently violent. But unfortunately, many of these shooting cases, they do, almost all of them, have something wrong upstairs.
Right.
And so when individuals see red flags before law enforcement is involved, what do families do? What should people do, you know, when they see this and they have concerns that, okay, it hasn't happened yet, but there's a flag here that I worry that he or she could be going in that direction?
Absolutely. First thing is to call our crisis line. I mean, if you see something that you're concerned about, call that crisis line that we've had up on the TV. Now, if it's something where it's right now, the person's got a gun, they're heading somewhere, call the police.
Of course.
Immediately. And let them know where that person is and where you believe they're going. Those would be the things that we would recommend. Matt, do you want to add to that?
Well, I'm just thinking, here we are in May, it's Mental Health Awareness Month. I think that one of the biggest barriers to accessing treatment is in fact stigma. And the more that we can really talk about the fact that most folks who have mental illness are in fact not violent, they're more likely to be perpetrated against than be a perpetrator. I think that goes a long way in addressing the stigma. So I just appreciate that Channel 5's doing this morning, because this is an important time for our field, and we want people to get the help they need. And there's many avenues and many portals to access to get that help.
I think another piece that speaks to the role we have as a department in this issue is we do have forensic beds where we can do evaluations, competency determination, and then if an individual were determined to be not guilty by reason of insanity, meaning they wouldn't go to the prison system, they would come to our system. So we're actively involved in doing evaluations and giving the judge that recommendation around the complex issue you raised. Was this violent act secondary to a mental health condition, or was somehow this person just
Do you know whether or not the accused shooter in the Waffle House would have been, the judge has ordered a mental evaluation prior to his next hearing. Would he be within a state system? Would that how he would be assigned? Would it be one of your hospitals doing that evaluation?
I'm not going to speak about a specific case, but there are a couple different avenues for those evaluations. One would be they could be in a private evaluation. I think we typically contract with Vanderbilt for that, so they could go to the jail site and do the evaluation, or a judge could send them to one of our forensic programs. We have a 30-bed forensic services program on the campus of Middle Tennessee Mental Health Institute, and the evaluation could be done there.
Okay, I'm just curious how that works out. Let's go to Megan. Megan, good morning.
Good morning.
Hi, Megan. What's on your mind?
I was just wondering, with the thought of, I've had a year clean. I'm a heroin addict, and they finally got my medicine right because I have a co-occurring disease, mental health as well. I was diagnosed with cancer. I had my cancer surgery, a kidney removed, and my doctor put me on Subutex to prevent propane, one, and also to prevent me going back out. And I just want to know what the thought of what she thinks or what they think of being on Suboxone is, Subutex.
Okay. Yeah, that's one of the drugs that they give you to help wean you off opioids, right?
Right, and to keep you off of it.
Okay, yeah, thank you. And that's a good call, because part of it, the governor's comprehensive plan to fight the opioid epidemic includes mental health treatment. So I don't know if you guys, any of you doctors?
We're not.
But Suboxone, of course, is prescribed in a lot of cases for recovering opioid addicts.
Yeah. One thing that we're very proud of in our department is the work that our substance abuse division has done in working with the providers across the state to look at medically assisted treatment alternatives for people that are struggling with addiction. Where we stand in our department is there are many pathways to recovery. There are some people that are listening that are saying 12-step is the way to go. Abstinence-based is what worked for me. We support that. There are other people that are listening, like Megan that's called in, that's saying, hey, I'm on something that's keeping me from wanting to use that drug. It's helping me control my cravings so I can really have a full life. And so that's going to work for me.
But the hope is she's not on that the rest of her life.
Absolutely. The main message that we want people to know is that you need to work with a trained, licensed professional, a doctor or a nurse practitioner, depending on where you're going for your treatment, and figure out what will work best for you. And with medically assisted treatment, one of the things that we have really stated, and our new regulations talk about this, is the need for wraparound services. We are not supportive of people just giving somebody a pill and saying, go forth and do great. We want that treatment provider to work with that individual, use whatever they think is appropriate for medically assisted treatment, and work around those supports so that they can have a life of meaning. So that's
maybe
where
she
we're
can
at
eventually, with time, come off that Suboxone and she gets that other wraparound treatment, right?
I think everyone's path to recovery is going to look different. And for some people, medication may work. For others, it may not. There's no universal treatment plan for the folks here in Tennessee. So I think that's just important to know that everyone's path is going to be different.
All right, let's take a break on that note. Back with more phone calls, more of our conversation with our fine guests right after this. Stay with us.
Storm 5